following is a Comfortably Zoned Radio Network production.
Thank you, Tally Olson. We are back. Canna Chat in the Zone. I'm Ralph Tyko with the Comfortably Zoned Radio Network, and my co-hostess is here, Ms. Carrie Tillman. How are you, Carrie?
I'm doing great today. How are you doing, Ralph?
I'm doing great, too. We have a special guest, and I'm going to let you introduce her, if you would.
We do. I'm lucky enough to call this lady a wonderful friend of mine. She has been a nurse for 50 years, and she is the director of clinical services over at a wonderful community-based dispensary called Magnolia Wellness in Oakland. And I'm so happy to have her on the show today.
Well, welcome, welcome, Barbara. On behalf of the network, we're honored that you're a guest.
Wow, it's exciting to be here.
All right. Let's, if you don't mind, Carrie, let me just take a moment to try to get to know Barbara for my sake and the audience's sake. And I'm just going to start by asking Barbara what kind of music you listen to as a kid.
Oh my gosh! As a kid, I would almost not even be able to remember. I lived in the Midwest. I lived in a small town in the Midwest. My dad's family was from Kentucky, so we listened to a lot of bluegrass music. As I grew up, my mother's family lived in California, and I became a Beach Boy fan. So I think that's where I started. The Virginia Reel. I can remember now doing the Virginia Reel in 4th grade. Wow.
Well, I can also remember Brian Wilson with the Beach Boys, and the famous statistic, 3 out of 4 of them were damn good swimmers.
I like it.
You can't always go by statistics, I guess.
Right.
And like taught me that lesson. Besides Help Me Rhonda and all those other great stories. Barbara, what did you read as a child? What influenced you, or who influenced you?
I was really into history, into American history, and I don't know that I could come up with any authors, but because I was in the Midwest, I was enamored with anything. And again, you have to remember I'm 75, so it was a while ago. So I was a fan of Abraham Lincoln and all that he had done. And then Nancy Drew. I was going to grow up and be a famous female detective, so I read Nancy Drew.
All right. May I ask you how you came to cannabis?
I came late, and I think that that's important for people to know, because many people, especially seniors, are still struggling with the ability to be able to access cannabis without worrying about the stigma that's attached to it. Mm-hmm. So I don't know if you know, but several of my children were active in the cannabis industry. In particular, Debbie Goldsberry, who is the owner of Magnolia Wellness here in Oakland. But Debbie became a cannabis activist back when she was a student at the University of Illinois. And people would ask me, what does Debbie do? And I would say, it's not my issue. I don't know. I finally said, when people wouldn't leave me alone, that she was an alternative crop lobbyist. And I did that. I did. I mean, I looked my dad in the face, and he said, what does Debbie do? And I said, she works for an alternative lobby crop group. And I didn't tell him for years because it wasn't my issue. And then in about 2013, I got sick, and I had major surgery but was recovering and needed to have a small repair. And the small repair put me in a coma on a ventilator with a feeding tube for a year. And when I was relearning to walk, which took 6 months, I began to study cannabis. I was allergic to morphine, my children were saying, "What are you doing? What about cannabis?" And for a while I said it wasn't my issue until one day I finally started reading about, in particular, children with epilepsy, children with neuroblastomas, people living with Parkinson's and dementia, and it became my issue. So I started taking it when I was 68. It's a long story, but I remember the first day that I came to Magnolia, front door was in a different place, but I waited outside that front door because I knew when I opened that door, my dead mom was going to be in here and she would be really pissed. Stigma does crazy things to you.
Well, I'll tell you what, my mother was influenced by reefer madness as a young child, as a young girl, and she never really got over it. I can think of the times that she'd tell me these scare stories that turned out to be, of course, all hypocritical, and it's amazing how people come to ideas. I think if you want to look at it, all cannabis is medical.
Absolutely. I absolutely agree.
But there is a buzz that a lot of us enjoy. I came to it for the buzz. Turns out that all these years of consumption kept me healthy, preventative medicine, this, that, and the other thing, but I still go to it for that that high, if you will. Did you experience that, or is it all pain relief? Is it all clinical? Do you ever get into just being high and communicating with folks and that sort of thing? It's not a right or wrong.
Right. No, I've been high a couple times.
Okay.
Generally not something that I'm terribly interested in. I have grandchildren that live in our home. I drive 25, 30 miles to work every day.
Oh, so, that's beautiful, because cannabis can help you drive safely.
Oh, and see, that's absolutely the truth. I sometimes take a low-dose cannabis. I'm using sublingual mints right now. If you drive now, say, to Pittsburgh down Highway 4, traffic, the regular traffic is 70, the fast traffic is 100, and then all those people going 30. And I'll take a sublingual just to try and make it home without doing anything ridiculous.
Well, driving down Highway 4 in Pittsburgh, traffic is the least of your problems, the least of your concerns.
True. Absolutely.
This is Northern California has several neighborhoods, let's say, and they're all very, very different in many ways. I would avoid Pittsburgh at anything, but that's just editorial. Carrie, would you take over for me? I think I've gotten to know Barbara in a very, very special way. You are a delight. And,
well, it was nice talking to you. You'll be on here, though, right? You're not just
I'll be on here. I'll be chatting, but I'm going to try to keep my mouth shut for a while and learn something.
Oh, wow. We're in big trouble today. I would like to defend my father. Carrie, let me defend my dad real quick, because I'll say for 10 years, I told my dad that Debbie worked for an alternative crop lobby group. And when I finally told my dad applauded and said all those Kentucky farmers who were no longer going to be able to grow tobacco would now have an alternative crop. And he was quite proud of her. And I think that's kind of critical for people to understand that some of the fear we have about being discovered, it's unfounded. We need to be loud and proud and step forward.
100% agree with you. And that's very similar to the journey that, I went on. I come from a family of tobacco farmers, and it's still federally illegal in the state where I'm from, in South Carolina. And I was really surprised by how supportive my family was when they started understanding my work in activism and advocacy and trying to understand medical cannabis as a means of harm reduction, and to be able to live a fuller life, a more complete life, and a healthier life. So I just couldn't agree with you more, Barbara. We need to be vocal about it, especially if we're lucky enough to live in a place where we have legal access. And when it comes to cannabis consumption, I was curious, Barbara, I've heard you talk about the 7 rights of cannabis consumption. Could you tell us about that a little bit?
Sure. So I graduated from nurses training in 1966, and usually people gasp and tell me they weren't born for 30 years after that or something. But and if I had to take my boards again, I would not be a nurse anymore. There's just no way. But I remember when we were learning pharmacology and when we were learning administering medications, that there were some critical things that you looked at. And as I've been in cannabis, I've learned that those same, they call them rights, those same rights are important for people who are using cannabis, whether you're using it as a medicine or whether you're using it as a recreational tool. The first one that I remember was that it's the right patient. If you've ever been in the hospital, even for an x-ray, now they put that little name bracelet on you and they ask you your name and your birth date and they check it and then they check it on the computer. They're making sure that you're the right patient. But if you're in cannabis, if you're going to start cannabis, you need, as the patient, to examine whether you're the right patient. And I have shared that I had a lady come and we did an hour-long interview to talk about what she was on, what her goals are, what she tried before. And it looked like she was perfect for cannabis. And then she leaned forward and she said, I just have one last question. She said, I've had a kidney transplant. It's only been 3 months. And if that fails, if I'm taking THC, will I be able to get another transplant? Having THC in your blood can possibly throw you off the transplant list. So she wasn't the right patient. People need to look at what meds they're on, what medical conditions they have, what their lifestyle is, and then decide if cannabis is right for them. And I have to tell you that as a registered nurse, I think that's the biggest the biggest goal of what I do is to make sure that people don't buy a lot of products and then find out that they give them a rapid heartbeat or they get paranoid even with a small dose. So the first of the rights is the right patient. Carrie, have you met anybody that you knew wasn't right? Have you ever run across that?
Yes, actually, in a group that you and I were teaching together last month, there was a lovely lady there who really could benefit from it, but she said straight out, is this something that I will fail my drug test for at work?
Right, true.
It's that simple. If this is how you provide your living, your insurance, a roof over your head, if cannabis consumption would jeopardize that, then you're not the right patient.
Yeah, and I think that...
Excuse me a second. Is there a mask? Is there a mask that is commonly used to disguise cannabis from being in your system?
No.
To fool these drug tests?
I would say no.
And Carrie, yeah, see, I believe no. I believe that there are dozens of vendors out there that are selling a tablet or a vinegar or something. But if it's your job, if it supports your family and gives you insurance, you got to do a real risk benefits analysis. Maybe you don't take it. People say, well, I smoke all day long, but I'm going to quit on Monday because they're going to test on Friday. No, it takes a long time for that stuff to get out of your system. A lot depends on how much you use. There are alternatives to using THC, which is what they test. You can get a CBD product. It's always possible, though, that there will be a small enough amount of THC that you will still pop positive. So you got to really examine the risk and benefits. And you'll hear me say that over and over. What are the risk and benefits in your life that makes cannabis what you need? Maybe you need to wait a while, only smoke in the summer. I don't know. You got to think about it.
Okay, I've heard, because it's legal in California, both recreationally and medically, is it legal for them to even test anymore?
Yes, it is.
It is.
Yeah, because It's federal. It's not legal. The feds aren't calling it legal. So it's possible. A lot of we're seeing, and again, Carrie and I are going to kind of do this together, but we're seeing more and more companies say we're just not going to test anymore. I don't think that OSHA, which is the Office of Safety Employee Health Services, that's terrible that I don't remember the name. They don't really have statistics that show the percentage of work site injuries that occur when the person's been smoking cannabis. There's not data that says, oh my God, this is so dangerous.
And they don't have statistics to show the injuries that have been prevented by folks smoking cannabis either.
That's a great point. Because there are days, I've seen really angry people. And I always think, well, take a puff of.
I taught traffic school for a number of years, and I taught a lot of people. The big thing that comes up, I don't know if it's just indicative to California, but road rage has become a big, big problem. And it's my contention that cannabis could cure that, but that's another topic for another show, and it's really important that people get to mellow out a little bit in life, not just in driving. So I'm happy to be able to combine a show that tells it from both sides. Barbara, right number 2.
I think it's the right reason. So in nurses training, if a patient was going to go on phenobarbital for seizures, you wanted to make sure that it was the right patients, that they were the right age, they were the right weight, they had the right symptoms that could be controlled by this. They weren't allergic to anything that interacted with it. They weren't on any meds that were going to cause it to work differently. So the right reasons are whatever, some of it for medical patients, for people who identify as medical patients, they need to look at that qualifying list. And all the states have different lists. But it's, insomnia, anxiety, epilepsy, depression, nausea, brain injury, PTSD now is, I think, one of the most significant. So are they taking it for the right reason? If you're taking it recreational and you have a problem or an issue, I'd like to say an issue. If you have a chronic mental illness and you're going to stop taking your psychotropic meds, you're tired of those meds, is it the right reason? Are your symptoms going to be manageable? Is your family going to support it? But it's really just, why are you taking it? And I will tell you that this is something that I'm so glad that we're talking, because people will come in. This happened yesterday. A lovely whole family came in yesterday, and one of the family members has had cancer for 2 years and decided that they wouldn't treat it. They would just keep working and not treat it. But now the pain is enough that they need something for pain. I think that you have to carefully examine if you have cancer, if you have diabetes, if there are things that you have to look at before you choose simply to use cannabis. Is it going to be safe? Or, what's your goal? If your goal is eventually you're going to go into hospice and you want to be comfortable until that time, okay, great, we have a product for you. But if your goal is long-term survival, then I can only speak for me, I think that you have to talk carefully to your family and to your oncologist. So are you the right patient? Are you the right patient? That's so critical.
Barbara, is there a program in place to educate physicians on what's going on? Because a lot of physicians really don't look at it the way you do.
Right. More and more doctors, I'm glad you brought that up, more and more doctors are asking actually cannabis nurses to come in and help educate them. Debbie's gone over and worked with some doctors over at, I think, San Francisco General. I've been asked to have residents in the John Muir system spend some time at Magnolia simply because they don't know what it looks like. What does the cannabis patient look like? What does the med look like? How do you choose which med to talk to a patient about? So we are seeing growth throughout the country, but it's going to be slow. Most doctors just shake their head and click their tongues. And even if they're supportive, they can't do anything about it.
And what's very scary, a major HMO, Kaiser, and
yes.
when I say major, it's major. It's in California. They are absolutely against anything with cannabis. If you're a patient in Kaiser and you tell them that you consume cannabis, they will cut your butt off, if you will. And that is going to come up in the courts eventually. Can you speak to that?
Well, I'm a Kaiser patient, as is my whole family, and my husband is seriously ill and is part of their pain management program, as is my granddaughter. And so if you test positive for THC, you get thrown out of that program. So neither of them use it. Nobody uses it. I am a Kaiser patient, and I take a medication called Coumadin because I have a history of blood clots. On the bottle it says, don't take it with cannabis. So I'm careful. I don't take it every day, but when I need it, when I want it, I test my cannabis, my blood level. There's a thing called the PTINR. I test my blood. It's normally 2.5. I take cannabis. The next day it's 7. That means that my bleeding time is a whole lot slower. So I call Kaiser. I actually call Kaiser, and I talk to the anticoagulant lab, and I say, last night I had cannabis. Here's my level. They say take 3 tablets for 3 days, test again, and call us back. They're not unsupportive. They're not judgmental. They recognize that people are going to use cannabis. And for me, they're fairly helpful. I tell my family practice doctor what I use. It's on my Kaiser record. But I think it's important that doctors know. I don't want to out anybody, but we do have patients whose Kaiser doctors are sending them specifically to Magnolia because we were at one time the only cannabis dispensary with an RN on staff. Now there are some others in other parts of the state. But doctors will send their patients here because they know that we're going to do an evaluation. And really that's the next right that I have is the right to education and evaluation. And from Magnolia's standpoint and from my standpoint, for a person to just buy cannabis, or people will say, well, my neighbor's been giving this to me for years. Well, but you don't know what it is. You don't know how much it is. Maybe your neighbor is wonderful, but you don't know if it's been tested. So you really have to, as a nurse, I make appointments and people get an hour and we evaluate what's your lifestyle, what's your goal, what benefit do you expect, because there's nothing worse than somebody expecting a miraculous change. I think that Carrie, I'm so sorry because some of these you've heard. So I read, before I became a cannabis nurse, I read from a study in Israel that cannabis would help improve dementia symptoms and would slow any new plaque from forming. You took 10 milligrams of THC a day. So I started taking it because I'm old. I didn't want to get senile. Now I'm still worried today about that. But so I took it for about 3 months and I didn't feel any different and I stopped. I just stopped. My husband and I don't talk about cannabis much. And about a week later, Stephen said, could you go back on that? So he could tell the difference. And I'm sure the people who drive on 4 could tell the difference. But so you have to have an evaluation of someone who's really going to listen and look at what you're doing. So if you come for sleep, I have insomnia, and I ask the person, well, tell me about your sleep habits. Well, I play video games until about midnight in the bedroom. I have a last cup of coffee. Well, I keep my room at whatever temperature. Well, let's look at that too. Maybe you shouldn't be playing video games at midnight. So evaluation and education are a crucial piece of success in the use of cannabis, whether you're recreational or medical. You need to know what to expect, what to do.
And you just brought up right number 4, which is the right cannabis, correct? I mean, if you have some idea of what the spectrum of products are, if you have some idea of what's already working for you, if you can take the time to make that appointment and have that hour to go over what is available at your dispensary, or if you're working with a private practitioner in your own home, you can go over, what's available now from patches to sprays. How do you go through finding the right cannabis?
Which again is one of the 4 rights. I think that it's important, first of all, to make sure that what you're buying is you're at a legal dispensary. The product has been tested. It has exactly what someone, either you or your friends or your children, have said you need to take. So the first thing I suggest is that you go to a licensed dispensary before you start anything. And then look at what the ingredients are. Understand the difference between THC and CBD, because people will come in and they'll say, I want straight CBD, nothing extra. Well, everything that I've read now says that the combination of CBD with a little bit of THC makes it absorb better, keeps it in your system longer, provides better symptom relief. But a lot of people don't know that.
Gives you a little buzz. Gives you a little buzz.
Well, and I love that you say that, because we have people come and say, I don't want to get high. And I had a bud tender say, well, why? What is that? Why? Because we're scared, because we watch Reefer Madness. That's why. Because a little bit of buzz, especially if I'm exhausted from life, and a little bit of product is going to give me back a tiny bit of spunk, then let's get a little high. But let's try it on the weekend in a safe environment. Let's tell somebody what we're doing, because people will say, I'm going to take it and go to work and we'll see what happens. No. Or people say, my mom's in the hospital with a feeding tube. We're going to sneak it into her tube. No. If I'm the nurse and I come in and your mom is different, you have to
sneak it into her cookies. That's what you make a nice brownies.
Right.
You don't have.
But be careful. Just make sure that you. So people will come in and they'll say, "Oh my God, my neighbor made brownies. They'd never bothered me before, and I almost died. What should I have done?" Well, you shouldn't have eaten that brownie. Maybe you should have tried a bite. But and there's cannabis, there are products besides cannabinoid. There are products called terpenes, and there's all sorts of terpenes. Lavender is a terpene, pine is a terpene, lemon is a terpene. And many of the terpenes, and this is really important to know, many of the terpenes enhance the action of the cannabis. So when you're asking a bud tender what's in it, and they're going to talk about different things, you want to be listening. But the reason that I wanted to mention it is that there are terpenes that are kind of the anti-venom to the high that some people get. So that means that if I'm feeling high and I begin to feel a rapid pulse rate and kind of anxious, and that's never happened to me before, simply smelling black pepper or lemon zest will tell your brain to release that action, and you will be able to stabilize. And I think that's fascinating, that these terpenes, because you can when you buy a product, you can always buy a bottle of high CBD, and that will cut through the high. If you kind of balance your THC with your CBD, that will cut through the high. But if you have just black pepper, you don't have to eat it. You just have to smell it, because it then is kind of like a tincture. It gets up into your brain really fast in 2 or 3 minutes, and the high is gone. So I just tell people, buy some packets of pepper and put them in your pocket.
Mm-hmm.
That's cool.
Carrie, have you ever had the need to come down from being too high on marijuana?
I have. I messed up one night and I went to get my tincture, and I grabbed the high-dose tincture instead of the regular dose tincture. And ever since that night, my husband gave me a locket that I wear that has peppercorn in it for this exact reason.
Well, that's great. That's great. I never thought about that.
This is a little off the subject, but a little on the subject. Magic mushrooms. If you're too high on magic mushrooms, and that's a chemical, and that can really make you high, uncontrollably high, eat a banana.
Oh, no kidding.
You'll really come down quickly on that. So that's education for not only you guys, but the entire listening audience. That goes on experience. I've been, the few times that I was lucky enough to do magic mushrooms, the few times, it's all relative as well. There have been times when I was too high, and the banana came in handy. So.
And how did you find that out? Did someone tell you, or were you accidentally?
No. Someone told me. A lot of these things are so subjective. Like one person's response or effect on one person can be totally different. My point is, one has to experiment for themselves, as you've been saying, what's good for you, for your metabolism, for your situation, your work situation, and don't be afraid to experiment, but start with low dosages when you're experimenting. You touched on that. Don't eat the whole brownie if you think it's going to be an issue. Save some for me.
Right.
Okay. I'll give you a mailing address, but that'll be...
I was going to say, has anybody got a brownie today?
I remember the Soupy Sales thing. When I was a kid, Soupy Sales had a show, and he implored the little children to go into their parents' wallets, take all the money out, and send it to me on behalf of CBS television or whatever it was. Same thing. You have too much pot, too much cannabis, send it to Ralphie Boy. He likes that.
And the address will follow.
The address will follow, but you get in touch with me and you'll find out a way to get it to me.
We'll talk.
I'm not shy. And you have a clinic, so you can supply me without anybody knowing.
Right. Are you in California?
That is not how any of that works, guys. That's just not how any of that works.
We're right here in California. Don't worry about it.
All right, we'll talk later. We'll talk.
All right. The three of us will get together. I'm in Alameda. Right. The three of us will get together sometime and do some testing, some very serious testing, young ladies.
Right. We'll have high tea together.
All right. As no pun intended. No pun intended.
Yes, of course.
All right.
Of course.
Carrie, let me hear from your voice in lieu of mine. That would be nice for everybody.
I really appreciate what you guys are saying about all these rights. So just to go over them real fast, what we've talked about is to make sure that you're the right patient, you're doing it for the right reason, you have the right education and evaluation resources available to you, that you can find the right cannabis for you and for what you're dealing with, that you're going to be able to know how to administer it the right way for you, whether it be, smoking, inhalation, patches, sublinguals, and that you know that you can find the right dose and that you can do it at the right time. I believe that covers the 7 rights, Barbara.
I think that's right. That's the right one, Carrie. Congratulations. And they are all so important. If you have an evaluation and you tell me that I haven't slept. People say this all the time. I haven't slept in 5 years. And I'll say, well, have you tried cannabis? And a lot of people are trying hemp, number one. They buy it in the health food store. They've been buying it by the mail, and people need to understand there is a significant difference. And I'm not the person that's going to discuss that. But if you tell me that you go to sleep, but you wake up all night long, well, maybe you need a tincture, which works fast, but lasts only a couple hours, to kind of help you get to sleep. But maybe at the same time, you need an edible that takes 2 hours to work, but will last 8 hours. So, you know, the right dose, the right route of administration, taken at the right time. Boy, I don't know who listens to your podcast, but one of the things that in particular, well, no, that's not true. I was going to say in particular seniors are interested in, but actually sexual pleasure is something that everybody is interested in. And as a nurse, I knew that you were going to have an issue, and you probably need to take a puff of something while we talk about this. But a lot of times I've done presentations with seniors on how to enhance your sexual experience, and if you take a tincture. So if I'm too nervous, I'm too upset, I'm too angry at the kids to relax, well, maybe take a tincture. But if you take a tincture, you need to wait about 10 or 15 minutes to make sure that it's working, but you can't wait 2 hours while the kids go to sleep, because then it's not going to work. So you have to pick your route of administration carefully. And if you're going to wait 2 hours, I was going to use my husband as an example, but he could hear this. But so you're not going to take an edible at 8 o'clock and think that you're going to be excited and ready at 8:04. You need to be thoughtful about how you're planning your evenings. That was fun,
I have
right?
a little advice about sexuality. If you're having any problems with your sexuality, just find yourself a new set of eroticisms.
Okay, you want to expand on that a little?
No, I don't.
Well, both Carrie and I have done. We've done some classes with a guy who works for Good Vibrations, and he's got toys that are his toys are remarkable.
I love Educator Andy.
I do too.
See, I'm an old enough guy. I used to party with the woman from Good Vibrations, and I can't think of her name right now. Very special. Okay.
But
it'll come to me 5 minutes after. 5 minutes after we're off the air. But yes, I recommend Good Vibrations and a new set of eroticism. You could do anything you want. I recommend you just have a great day. This has been a terrific podcast, and I can't wait to meet you in person, Barbara. And
I look forward to it.
You're right down the street. We're from Alameda, California, but we go all over the country, all over the world, and we hope to make cannabis a good experience or enhance the experience for people by educating. And education, knowledge is power. Although knowing can be the booby prize, you got to be careful of that too. Life is a yin and yang. Carrie, close us out.
I hope everybody's learned something today about how they might incorporate cannabis into their lives in a responsible way, or choose not to because it's the better choice. And I just am really grateful for you guys. It's been a really lovely podcast.
Beautiful.
Thank you so much for having me.
Barbara, I would love it if you will return on a regular basis.
I would love to. I would really love to.
Beautiful. You can be one of Carrie's regular guests. Thank you for bringing her, Carrie, and we'll be back at you as soon as you know it. It's the Comfortably Zoned Radio Network. I'm Ralph Tyko, the weak link of it all. Adios, everybody.
Bye.
Bye.
The proceeding has been a Comfortably Zoned Network production. You are advised to keep your dreams wet, your humor dry, your children and grandchildren out of military recruiting offices and off the laps of clerics who wear dresses. Thank you for listening, everyone. Happy trails.